All right, those are the big headlines at this hour. Let's quickly take you through what are the numbers telling us at this point when it comes to COVID. First up, an all India figure for you. If you see over here, the total number of cases are up by almost 46,951 and the deaths also up by around 212 at this point. So this upsurge that we are seeing and the percentage, the drastic rise that we've seen is a reason of concern. Let's look at now the top states which are contributing to these figures, and you'll see the same names actually feature again that we've seen in the past couple of weeks as well. Maharashtra, over 30,000 cases in the past 24 hours. Punjab over 2,600, Kerala about 1,800, Karnataka 1,700 as well, and Tamil Nadu about 1,200 cases in the past 24 hours. When it comes to deaths, however, do you see the proportion there of Punjab changing, with 44 people dead, with barely about 1,500 or so figures of COVID-19 cases coming in from Punjab, which is a case of serious concern at this point. Maharashtra, 99 lives lost in the past 24 hours, 13, 10 and 9 for Kerala, Chhattisgarh and Tamil Nadu. Let's bring out more figures for you. We are obviously talking about and extremely concerned about the second wave at the moment, and states which are witnessing clearly a second wave. Maharashtra. Now you see that figure over here? Almost 21,000, and now we are up from that peak to 30,000, over 30,500 at this point. And this is when, this was around mid-September over here, sometime around that time. And this was, around Diwali, when marriages, etc. were happening. And now we have crossed even that. Punjab showing us a similar trend. Mid-September is when Punjab saw about 2,000 cases, beg your pardon, come in every day, and now we've topped that, over 2,600. So clearly in pockets we are seeing a clear wave come up. Let's go to the other states. Gujarat, for example. Gujarat again, since the first week of December, when the cases for the first time went up to about 1,500 or so, we are roughly around the same figure, a little higher in fact at this point. Gujarat also continues to be a major concern. Lots of containment zones coming up. Karnataka also, you see a similar trend. From 998, it's gone up to about 1,700, and this is again a peak. The last time we saw that was in December. Let's look at Madhya Pradesh now, where in first week of December, we saw about 1,400 cases and now about 1,300 cases coming one more time in Madhya Pradesh. All right, so those are some of the statistics at this point. We also have some figures which talk about how and the positivity rate that is going up. Now, lots of figures over here, don't get confused. These are essentially, if you go to the next graphic, you'll see that as well, a constant upsurge of cases that you see. And then the basic figure and the cause of concern at this point is the fact that there are about 8 states where the positivity rate is above the national average. Now, there are cases as well. This is the one which has deaths, where 86% of the new deaths are being reported from these 6 states. You have Maharashtra, Punjab, Kerala, Chhattisgarh, Tamil Nadu, Gujarat. And also, if you see the national average that we've talked about of coronavirus cases, there are about 8 states or so where the national average is drastically lower than the average in these states. So these are some of the things that we look at over the course of our discussion. Joining us on the program today, we have Dr. Anjan Kha, we have Dr. Jaleel Parker, we have also joining us, Girdhar R. Babu, Professor for Head Life Course Epidemiology on the program. Thank you all so much for your time. Let me begin with Dr. Anjan first. Doctor, so the picture that becomes clear to us after looking at these facts and figures at this point is, A, the spike is very drastic. B, in the second wave, as we earlier thought that when the spike is much, when the spread is large, deaths are lower. That's not happening. Deaths are also higher. C, we are seeing that it's not happening across the country. It's happening in pockets, specifically in about 8 states, which are an area of absolute concern at this point. And then the fourth point, really, that all this is happening when the vaccine rollout is already taking place. So Keeping these factors in mind, what do you think are some of the things that are required and are the need of the hour?
Okay, so what you said is perfectly fine. All the 4 points which you made are true, right? What is required is that people think that if they got vaccinated, they are good and healthy and fine, they have started going out. Citizens as such have lowered their guard. Maybe they are tired of taking precautions or whatever. So this is the time when the second wave will hit us. It normally starts from pockets and then it spreads. We have numbers rising in Punjab, Maharashtra, various other states, and it's but natural that they will spread all over the country. So we have to be as careful as we were in the months of June and July, and only then we can stop. Other thing is that if the vaccinations are taking place, it will take some time before the vaccine, the first shot and then the second shot, and then after the second shot it takes some time for the antibodies to build up, and there would be some people who would be outside that efficacy number which is mentioned in various type of vaccines. So it's just that we have got to remain careful. We got to take care of everything the way we were doing in the month of June and July.
Yeah,
otherwise
that's sure,
the
doctor,
second
but you know, the reason I'm interrupting you at this point is, and I want Giridhar R. Babu to sort of take a word in on this one. You know, we keep saying that it is COVID inappropriate behavior that is leading to these spike in cases. If that's the reason, then why is it happening only in pockets? And also happening in states, in cities perhaps, which already have a great amount of seropositivity. So what is this? Is this a new strain? Is this a new sort of mutation that has emerged, is in-house?
All brilliant questions here. The first point we need to focus is the states which are testing well are the states which are detecting higher cases. So if you see the number of tests done, the tests are done mostly in Maharashtra, Telangana, Punjab, Karnataka, and these are the same states which are reporting higher number of cases. I'll give an example of Madhya Pradesh. Their test per million per day is around 274. And if you look at the way they are surging, it is in the top 5. So my point here, number one, is all tests are same, not same. RT-PCR is different, RAT is different. States that are not doing tests well probably are missing the cases, number one. Number two, it is possible that there might be a newer strain, but we do not have the evidence of circulation happening. And also we are seeing more proportion of people who are having asymptomatic infections. That might mean that more and more younger people who are going to work or those who are protected earlier are the ones who are getting infected. Finally, regarding COVID inappropriate behavior, I don't think that is unique only to these states. I think that is universal. Now you are seeing almost rallies and functions and everything happening without any restrictions. Therefore, lack of circulation only means that lack of effective surveillance in that area.
Okay, let me bring in Dr. Parkar then at this point. Dr. Parkar, you join us from the Leelavati hospital there. What are some of the concerns or some differences perhaps in patients this time around in the second surge in Mumbai that you're witnessing, or are there any? And are you also then beginning to think that there is a bit of a shift in the virus, a bit of a new mutation perhaps that we're talking about?
I think since COVID-19 has evolved over a couple of months, now it is nearly, I would say, 10 months or so. So what I have seen is that the criticality has reduced. Yes, of course, it has reduced, but the sheer volume is increasing. So the surge is definitely there. Maybe even the medical fraternity are more, I should say, alert, more experienced with this COVID virus. And that is why what you see is the criticality not being so much, because we are nipping it in the bud, we are treating in time.
But is that so? But is that so? Because the steady rise that we've seen in the number of deaths is also quite critical. I'm not sure if Mumbai is not showing so many deaths, but across the country we've seen a very sudden spike in deaths as well, and that's also an area of concern. Dr. Anjan, if you want to take that question as well, any difference that you're seeing in patients this time around when you see them in your hospital and ICUs?
Yes, see, to be honest, in the last 5 days, the number of patients in our ICU has gone up by about 40%.
Wow.
So the number of cases has increased, obviously, but at the same time, one must accept that now doctors per se are a bit more confident in treating these patients. This was not the same which was happening in last year in the month of April or May. There was a fear or people were afraid of treating these patients. A large number of patients are being treated at home, and only those who are sick are coming to us. The second thing is more and more people who are older are getting infections, and they are suffering from various diseases for which they are going to various hospitals, which earlier they were not going to their hospitals. So they are becoming positive and getting to us. And regarding your question on certain pockets being positive and certain pockets being not positive, you will just wait and see that as the people shift from one state to another, this will spread. Delhi as such was late getting the numbers. We got them. Gradually we are increasing. So there's nothing different. Everything doesn't strike at the same time and across the country. We are a huge country. So it's just that I again impress upon you and the people that please don't lower your guard. The guard has been lowered. There have been agitations, there have been elections, there have been parties, there have been marriages, there have been religious functions where we are all going, and we've just decided not to take care of ourselves. Then what has been pointed out, sorry to interrupt you,
go ahead.
The younger people are healthier, they are asymptomatic carriers, and once they go around and talk and meet older people or their own relatives, they're going to spread it to them. This is where the problem lies.
And then that's the question that is on everybody's mind. Isn't it time that India opens vaccine for all, as clearly just preventing those who are elderly and at home is not enough at this point? India clearly has the capacity to do it, as we are exporting more vaccine than we're actually using inside the country. So that's a thought we'll leave our viewers with at this point. To our panel, thank you so much for joining us. That's all we have for you in Coronavirus Facts versus Myths today. See you again. Bye-bye.